My name is Dhami. I'm one of the physicians at Eastern Connecticut Hematology and Oncology, and today we will discuss the risk of blood clots in COVID patients. It has been recognized that the patients who have COVID are at high risk of developing blood clots. And it seems like the risk increases as the severity of illness increases. For example, patients on the medical floors are at low risk of developing blood clots compared to patients who are on intensive care unit, and the highest risk are patients who are on intensive care unit are on ventilator. The blood clots may present with various symptoms, and most of the times they will present with either chest pain or shortness of breath when patients has a clot in the lungs, or pain or swelling on the leg if they have a clot in the leg. The risk of blood clot increases as we grow older. The risk of clot in general is about 1 in 1,000, but it may be 1 in 10,000 in a teenager and maybe 1 in 600 by the time you get to my age. We know that the cancer and clots go hand in hand. What that means is that patients who have cancer have a higher risk of developing blood clots compared to general population. And patients who develop a blood clot, especially the clot out of the blue, have a higher risk of being diagnosed with cancer over the next 2 to 3 months than general population. But with COVID, we are also seeing some rare types of clots. We have young patients presenting with strokes, for instance. The current recommendations to treat COVID-associated blood clots are standard blood thinners, which is usually either heparin or low molecular weight heparin, to be followed by oral agents. But what's new from recent International Society of Thrombosis and Hemostasis meeting is that we have now clarity on what doses to give to what type of patients. So for blood clots caused by COVID, we need to treat our patients depending on the risk stratification that we do when patient is sick in the hospital. But keep in mind that the risk does not go away when patient leaves hospital, and based on certain clinical characteristics, your doctor may recommend continuing blood thinner as an outpatient. Blood clots can be very dangerous, and so if there's any concern about developing blood clot, for example, somebody has chest pain or shortness of breath, which is of sudden onset, or all of a sudden there's a swelling and pain in one of the legs, or any neurological symptoms, that is a time to either call your doctor immediately or come to the emergency room. The Delta variant, unfortunately, in 2021 is making a lot of people sick, especially the ones that are not vaccinated. This variant is much more infectious, usually spreads in families very quickly, and best way to avoid sickness and also COVID-associated blood clots is to get vaccinated.